Is febrile neutropenia a common risk during leukemia treatment? Imagine fighting leukemia with powerful chemotherapy that aims to wipe out cancer cells. While this treatment is effective, it also hits the healthy blood cells in your bone marrow. One of the most common side effects is a drop in neutrophils, a type of white blood cell that helps fight infections. When neutrophil levels fall below 500 cells per microliter, the body becomes much more vulnerable to infections. If a fever develops during this time, it is called febrile neutropenia, and it is a serious concern during leukemia treatment. Febrile neutropenia is especially common during the initial phase of treatment known as induction therapy. This phase involves aggressive chemotherapy to quickly reduce leukemia cells. Because the treatment is so intense, it often causes myelosuppression, which is a suppression of bone marrow activity. This results in a significant reduction in neutrophils, impairing the immune system's ability to fight off infections. As a result, patients undergoing induction therapy are at high risk for developing febrile neutropenia. The presence of fever in a patient with low neutrophil counts is a signal that an infection might be present. Since the immune system is weakened, infections can progress rapidly and become life-threatening if not treated promptly. Medical teams usually respond by hospitalizing the patient and administering broad-spectrum antibiotics that target common bacteria, including Pseudomonas aeruginosa, which can cause severe infections. To reduce the risk of febrile neutropenia, doctors often use preventive strategies. One common approach is giving granulocyte colony-stimulating factors, which help boost neutrophil production and shorten the duration of neutropenia. Sometimes, doctors also prescribe prophylactic antibiotics or antifungal medications, especially for patients at very high risk. Close monitoring of blood counts and early treatment at the first sign of fever are essential parts of managing this risk. Despite these precautions, febrile neutropenia remains a frequent complication during leukemia treatment. It highlights the delicate balance between attacking the cancer effectively and protecting the patient from infections caused by immunosuppression. Recognizing and managing febrile neutropenia quickly is vital to prevent serious complications like sepsis and to keep the treatment on track. In summary, febrile neutropenia is a common and expected risk during leukemia induction therapy because chemotherapy often causes significant neutropenia. It requires vigilant monitoring, prompt treatment, and preventive measures to ensure patient safety. Always remember that each person's experience can vary, and it's important to work closely with healthcare providers to tailor the best approach for individual needs. If you or someone you know is undergoing leukemia treatment, discussing infection prevention and management strategies with the medical team is key to achieving the best possible outcomes.